Good evening, everyone. My name is Scott Allen. I'm the CEO for the Family Medicine Education Consortium, and I want to welcome you to tonight's Family Medicine Residency Virtual Showcase. We are going to hear about comprehensive family medicine from the Forbes Family Medicine Program at Allegheny Health Network. But before I turn it over to Dr. Nikoloff to speak, I want to give just a little bit of background about the FMEC. So we consider ourselves a catalyst, a convener, and an incubator. And really, some of our goals are on the screen, but I like to think of it as threefold. One is we try and help medical students and medical schools learn more about family medicine and help medical students meet family physicians and think about that as a career option. We like to help residents who are in training at family medicine residency training programs by giving them opportunities to present and do scholarly work, and by meeting each other and just generally thinking about what they're going to do with their career once they're finished with training. And then we like to help the family medicine residency training programs by helping the faculty, again, do scholarly work, get presenting experience, meet each other, learn from each other, share how they're meeting ACGME guidelines and things like that. Our region is the northeast of the corner of the US, about 14 states and DC, and there's a little map on the screen. And in those states, there's 60 medical schools and about 220 family medicine residency programs. We do an annual meeting each fall. Hopefully some of you either are going or have been or will go next year, where we bring about 300 medical students to the meeting from the region, from medical schools in the region on scholarships. We have a residency fair where they can meet residency programs. It says over 90. Last year we had 93. This year we have 102. So bigger and bigger every year. And then we do an awards program. We have some learning collaboratives and quality improvement initiatives that clinics and practices can get into. And there's lots of ways you can get involved with the FMEC. So there's a little bit about our meeting. It's about 3 weeks away in Philadelphia. And if you are interested, there's still time to register or apply for a scholarship if you're in the region. And with that, I am going to turn it over to Dr. Nikoloff to talk about comprehensive family medicine.
Thanks, Scott. It really is a wonderful conference, everybody. I highly encourage you to go and meet people from the program, see some really great talks and lectures, and just, kind of network with other family medicine interested folks. So it's a great conference to go to. Thanks everybody for being here tonight. My name is Stacy Nikoloff, and I apologize for being in my car. I got caught in a rainstorm and I told Scott, I was like, well, sometimes you just have to maneuver, right? You got to do what you got to do. So anyway, luckily I have my computer and we can talk this way. I'm the program director for Forbes Family Medicine. Our program is located on the east side of Pittsburgh in Monroeville, Pennsylvania. And we have 24 residents there. It's an 888 residency, and we're unopposed. So essentially the only residency program at our hospital, which really does provide the residents, with one-on-one, training, and really not much in the way of, sort of other residents, bartering for procedures and all that kind of stuff. They really have first dibs on honestly pretty much anything they want to do. They have that opportunity. So I just wanted to come by and sort of talk to all of you a little bit about family medicine in general, because I think that unless you've worked in a family medicine practice or been involved with a family medicine residency program, sometimes there's sort of misconceptions out there about what family physicians do or can do. And so I just wanted to familiarize you a little bit more with some of the things that we do that I think are unique to family medicine and comprehensive family medicine specifically. So how many of you have done your family medicine rotations or have experienced some type of family medicine? Okay, so basically everybody. So that's great. Yeah, I mean, I think that depending on where you are, you have a different experience, right? With who you rotate with most rotations. Have you heard certain things? I've heard lots of different things as far as what family physicians, like, how do people refer to family physicians? What have you heard? Anybody?
I can say that everyone refers to us as the outpatient primary care doctors. Like,
Sure.
you're not the internist, you're the outpatient person.
Right. Yes, definitely. Anything else?
What I hear mostly is when you meet one family medicine doctor, you've only met one family medicine doctor.
Mm-hmm. Absolutely. Yeah, so I think we hear a lot of different things, right? The PCP, like you said, the outpatient primary care doctor. Some people say, "Oh, they're sort of the jack of all trades," and I've heard some folks honestly be sort of offended by that, or have issue with that. And to me, I take it as a compliment. I think, yes, what could be more, versatile than learning about everything in medicine. I do a lot of interviews, obviously, with med students for the residency program, and I will always remember one med student in particular. I said, why are you choosing to do family medicine? And I hear lots of different answers all the time. And he said, because it's the most challenging field in medicine. And I really, took that in and, sort of remembered that because it's true. I think we certainly are exposed to lots of different things, and versus a specialist, right, that knows a lot about certain things, we know a lot about a lot of things, or we could, so it really, I think, is up to us as primary care doctors and as family physicians, to be great family physicians and know a lot about a lot of different things. And that's on us, that's up to us how good and solid of a primary care doctor we want to be. Nothing against specialists. My husband's a rheumatologist, and we need specialists too, for sure. But I think that we serve the community in a very different way, and so that's something that I've grown to really appreciate. And I think that family medicine versus other fields of medicine is constantly evolving, right? I mean, you could be watching TV at night and see 5 different commercials of different medications for diabetes or weight loss, or all kind of different things. And we're really challenged with knowing a lot. I find myself looking these things up, like, what is that drug? I've never even heard of that one. So it's constantly evolving and changing. And I think, thinking back to the pandemic, who was first line, taking care of COVID patients? It was family physicians. We were the people, sort of triaging that whole situation. We were doing telemedicine. We were really taking care of folks on the front line. And, like you had mentioned earlier, being outpatient providers, yes, but we were also in the ICUs taking care of really sick patients. We were in the hospital rounding. So again, it's really up to you how much or how little you want to take on as a family physician. And I think that's an amazing opportunity that we have as practicing physicians. I think that we're sort of big picture people too, just by nature. I don't think I've ever met a family doc that I really didn't like or enjoy. It's funny, I think that there's so much focus on detail with specialists and surgeons and things like that, and we definitely see sort of bigger picture, right? So we're sort of the captain of the ship, or some people say, the quarterback of the team, where you are coordinating all different people, to care for a patient on a lot of different levels and in a lot of different places, right? We go to nursing homes, we round in the hospital, we see people in their homes, we do home visits at Forbes Family Medicine. So again, it really is up to you, how much you want to do. So what types of things, when you were doing your family medicine rotations, I mean, what types of things did you see that made up family medicine in your experiences?
Mine was primarily outpatient, and like primary care, did a lot of physicals, but also some like acute visits. And I think I've gotten a small taste of how family medicine can definitely look different depending on where you are in the setting and all of that. So.
Absolutely. Yeah. Anybody else? Anybody see things or work in a family medicine practice and be surprised by something that they did or that they saw walk through the door?
So actually, hi, my name is Nina. I'm from American University of the Caribbean, and I worked for a year at the Bronx Care Hospital. So it's the poorest zip code in America. And at that hospital is where I kind of fell in love with family medicine because they had their own floor and it was different from the other experiences that my friends in medicine had, where it was very much inpatient, and we were dealing with a lot of cases where you were the captain of the ship. And that's kind of where I loved it. Like what we say is how did they say it? Like jack of all trades, master of none. And that's kind of what the family physician was. They were the ones who we deal, like, especially since the Bronx care, with a lot of chronic conditions gone bad. So it's basically you're on the other end of family medicine, where the physician basically, let's say, wasn't there in the beginning, and now you're getting them as geriatric, or when it's diabetes has gotten so bad that we're amputating them. So we got to make decisions as in, like, do we amputate this foot or not? I mean, it's very funny to, and like something very common sense. But something I learned as a family physician and a rotation is that if I see bone, I'm cutting it off. Like, that's very crude to say, but when it's a very fast-paced environment, and then like you can't call the surgeon on every single detail. Like, it forces you as a family physician to realize, like, you know what? Hey, no. Even though I'm a student, like, you kind of have to take more accountability and rise, because you're like, if this is what I'm seeing, imagine when I'm alone on residency in a year, like, there's some things that stick with you, like very like jerk knee reflexes that you acquire. So I never thought of a family physician doctor. I always thought of you as dealing with a cold or dealing with a virus. I don't know. Like, I don't come from a medical background. I'm an engineer in my past experiences. So it was very, very exciting and very nice to see that we can take leadership and that you are respected. Like, the surgeon, when he comes to us for consultation, he's like, no, this is your patient. Like, what do you need me to do? I can't review him from A to Z, but I can come in for the part that you are referring me for. And it's very nice to see it. And it's like more of like a acute, fast-paced environment. You see the kind of care of a whole patient from A to Z. And I really appreciate it. And that kind of made me want to pursue family medicine. And also the fact that we're involved in OBGYN. That's something that I even get, that I think is not talked about. But as a woman, I love that I get to have experience with that.
Absolutely. No, I think that's so great. And it thrills me to hear that you had that type of experience, because some people don't, I think that, yes, something, just to talk about some of the things that we do, right, that are not typical. We do chronic disease management. Yes. We do preventative visits. I think everybody knows that. We do sort of urgent care type situations, right? Like viruses and things of that nature, with kids or adults. But some of the things that we do that I think a lot of people do not recognize are, for example, what you said, OB. We do tons of women's health, right? At our practice, we have 2 faculty now that deliver babies with the residents. The residents have continuity patients that they follow throughout their entire pregnancy. Their first assist on C-sections, because like I said, there are no OB residents at our hospital. And so, you're getting a lot of experience with doing that as a family medicine resident. Some of the other clinics that we do in our office, just to name some, because I think it's pretty remarkable, really, and it kind of shows the breadth of comprehensive family medicine, if that's what you want. We do lots of mental health. We have a full-time behavioralist at our practice that we do counseling with. So this morning I had a patient, we sat down for an hour, with the behavioralist, and we talked through this patient's anxiety and gave her resources and things of that nature. We do osteopathic manipulation, so we're doing that as a procedure. We have a clinic 1 day a week where basically residents rotate through there and they do OMT in our office. We do MOUD. So we're doing opioid, treatment with Suboxone. And we have a bunch of research projects even surrounding that in the community, where we're working with EMS and bringing those patients in to hook them up into our clinic for opioid abuse. Sports medicine and musculoskeletal care. Obviously we do lots of MSK stuff as family docs, back pain, knee pain, neck pain, all of those things that you would imagine. And one of our providers, Dr. Wolf, who works with a lot of our medical students, he also is dually certified in HIV and transgender care. So the residents rotate through, those clinics with him as well, and gain an immense amount of experience and knowledge, from him. Something else that we do that I really enjoy, and I encourage other family medicine residencies to do and pursue, and we've even worked with other family medicine residencies on this, are pathways. So this really is it stems from surveying our community to see what the actual needs of the community are. So we have a pathway, a weight management pathway. So this is a multidisciplinary group that gets together one afternoon every week. And there's a social worker, there's a pharmacist, there's our counselor, there's a resident, and we all sort of gather together and talk through weight loss for a potential patient. So we teach them exercise counseling. We talk about medications that could potentially help them. You know, we do behavioral therapy, right, with motivational counseling and things like that. So I love that multidisciplinary approach for patients, and I think it's really tough to find in other specialties. I think family medicine does that really well. And we love that, you know, sort of collaborating with each other and coming up with different protocols, you know, to work as a team to help patients. We do that we have a diabetes pathway as well for our really difficult to manage diabetic patients. And we developed a hepatitis C pathway as well. So for patients that have hep C that come in, you know, we found that it was really challenging to get them in to see, you know, hepatologist or specialist and get the blood work they needed and the medications. And so we developed a pathway where we can basically do all those things ourselves. And we've had, you know, really nice success with that. So again, I think that, you know, in family medicine, you're as good as you want to be, right? And I think that if you surround yourself with people who really, you know, want to go the extra mile and want to learn more to take care of their patients in a very comprehensive way, you can do that, you know? And so I encourage you, if you're interested in family medicine, to seek out people like that, you know, be it residency programs or mentors, you know, that really want to sort of go that extra mile and you know, teach you things, right? So that the goal, right, being that when you graduate and you're out practicing on your own, that no matter who walks in the door, you've been exposed to that. You've seen it, you know, you've handled it in some fashion or another. And, you know, that builds your confidence and also obviously helps your community and your patients. So just some things to think about. We do tons of procedures too. So if you're somebody who's really hands-on, you know, and likes to do a lot of procedures, joint injections, skin procedures, a lot of women's health procedures. You know, we place IUDs, we do biopsies, colposcopies, circumcisions. I mean, again, you know, it's sort of, you know, as comfortable as you are with your training. I even learned how to do cosmetic dermatology with one of the residents because they wanted to pursue this. So he said, would you go learn how to do Botox and fillers? And I'm going to go learn. And then we're going to do a Botox clinic 1/2 day a week. And I thought, well, that's kind of crazy, but okay, you know, I've never learned how to do that. And so we did. So again, I think you can really kind of push the envelope and continue to develop your skills over the years. You know, I mean, I didn't think I would ever know how to do that. And now I do because of a resident, you know, who came to me and was interested. So again, I think surrounding yourself with people that are excited about medicine and that want to try different things, that's really the way to go for sure. Something else to mention too, you know, I think that a lot of times, you know, people think that internal medicine is the only way to go for fellowships, and that's definitely not the case. You know, family medicine, we've had a lot of people go on to do fellowships in palliative medicine, in sports medicine. One of our residents last year went on to do an OMM fellowship. He's at Dartmouth in Maine currently as we speak. Hospitalist medicine. We have a resident applying to pain medicine this year for a fellowship. So there's lots of opportunity too if you want to continue on to become more specialized within, you know, family medicine and that realm. So just to kind of introduce that thought to all of you, because I know people have been surprised by that. You know, when I say, oh, you want to do pain medicine, you can do family medicine and then go on to do pain medicine. So something else, you know, just to keep in mind. Are there any questions about that? Yeah.
I have a lot of questions actually, but if anyone else wants to go. Okay, I'll ask. So you mentioned the first thing I would like to know is great presentation regarding your program. It kind of got me really excited. It sounds like there are people like-minded individuals out there. I think that sometimes when we're in med school, it kind of gets a little difficult sometimes. We just think that no one would, I don't know. It's just maybe I have experienced that, but regardless, what is your patient demographic, you would say, at the program?
So I think we're pretty diverse in our program. Which I enjoy. We definitely see full spectrum family medicine, and that's something else that you want to look for in a program. I think that we do newborns all the way to geriatric and end of life care, and sort of everything in between. I think the majority of our patients are. I think we just did this because we had to turn this information into the ACGME. We're between the ages of like 12 and 60. That's sort of the majority of our patients, but we definitely see kids and we definitely see elderly patients too. We have multilingual patients. We have translator service that we utilize quite a bit at the office. And so that's, again, a pretty diverse group, not really one particular, sort of culture or group that we're seeing or language, so that's why we use the translators, because it's, like I said, pretty diverse.
Okay, thank you. And then another question that I had, I don't know if this one is a little more challenging to answer, but it's something that I struggle with as like I'm starting to seek residency programs. So it is easy to say that you want to find a program that helps you push the envelope, but it's easier when there's a curriculum that's built for you in order to do that. So how do we evaluate like measurable outcomes for a program? For example, yours, when you say that you have people and training that goes the extra mile. For example, you mentioned Dr. Wolf that has a transgender certification. Does your program offer such certificates? Do your residents graduate with such certificates? You can speak more on that. Thank you.
Yeah, so I think that, it really depends on, what it is that you're seeking out. So we have something that I think is really unique to the program, and I encourage you to look for this, in programs, that there's some flexibility around electives, that they have a lot of elective opportunity for you to seek out, that the faculty is diverse in their interests. I think that is a huge plus to a program. I was at a program before, and half the faculty was very into sports medicine, which is great. And it was very strong in family medicine. But when it came to women's health, global medicine, other things, it definitely wasn't as strong. And so I think that looking at the faculty when you're interviewing and kind of seeing what people's interests are will help you to know if that's a really diverse group of people with lots of different interests. We're doing something also now called a longitudinal, where basically 1/2 day a week, the resident gets to pick what they want to do. So that's where that cosmetic dermatology clinic came in for my resident before. People do research, people do teaching electives, people go and do, high risk OB rotations for 1/2 day a week. They go and work with providers. So again, I think that programs that have a little bit less structure and a little bit more flexibility around their curriculum is sometimes a positive thing, because if you have particular interests, that you're excited about, then you have the opportunity to pursue those, and you're not sort of locked into just, the core curriculum. So I would look for things like that. Lifestyle medicine, that's something else that we just incorporated this year. And the residents actually have the opportunity through the program to become dually board certified. So they can graduate and take the family medicine boards, and they can graduate and take the lifestyle medicine boards if they want. They don't have to, but again, that's sort of a track that you can choose. So, looking at your interests and looking at the program and trying to see if those things align. And if you feel like, going there, you'd be able to pursue some of those things that you have particular interest in.
Thank you so much, Dr. Nicola.
Yeah, for sure. Other things, to consider, I think that two more things that I would just mention to you. Again, I think that having variety over the course of your career is something too that's pretty cool that a lot of folks don't have the opportunity to do. So, I have partners that started out doing urgent care because their kids were young and they wanted shift work and they didn't want the in basket when they went home, and that type of thing. And so they were doing 12-hour shifts 3 days a week and kind of loving it, the acute thing. They're in and out, and did that for a while. She went on to do global medicine. She was working at with a organization in Kenya. So she did that for a time, and now she's faculty, So again, your career can really change, and you can sort of mold it to what you want it to be over the course of your career in family medicine, which, again, you think cardiologist or, even an internist to some degree, you don't have that level of sort of flexibility within, your actual field of medicine. And so I just point that out because I think that's really sort of a cool thing, that family medicine has. The other thing is the work-life balance. And, you know, the more I go on in medicine, you know, the more challenging it is, right? We're asked to do more and more all the time, and this isn't going to change, you know. So you guys are going to be certainly coming up into that as well, where, you know, there's a lot of responsibility. Um, and so it's really important to, again, look at programs and look at the folks that you're going to be working with that, you know, have some type of work-life balance and, you know, enjoy that. I think that, you know, we really try at the program, we're pretty flexible with each other, you know, so it's like, hey, you've got, you know, a wedding to go to, I'll take your call. You've got this, go ahead and do that, you know, and we really work together to sort of balance that. And we plan activities with the residents for wellness. You know, we block some administrative time for them during the week so that they're not bogged down with charts when they go home. Hopefully they can get some of that done at work and then go home and go for a walk and hang with their spouse or their family member or what, you know, whatever the case may be. And I think that's really important over the course of your career to have that balance so that you don't get burned out. And, you know, you're a better physician, I think, when you have a more well-rounded sort of balanced life. So family medicine, I think, really provides that for a lot of people. And sort of, I don't know, I don't think it's a focus, but I think it's something that we're cognizant of and we pay more attention to than maybe some other fields of medicine. So just something to think about. Do you guys have any other questions? That's sort of what I wanted to present to you as far as, you know, just talking about the residency, talking about family medicine in general and how, you know, comprehensive it can be. But we can take a few minutes and do questions if anybody has anything in particular.
I had a question about kind of this balance that I hear you talking about of having a really broad spectrum training, but also being able to pursue specific interests. And I was curious to hear you talk a little bit more about how to balance sorry, how to balance those things. And you know, at your program, I think you talked about like tracks maybe as a way to formalize that. But yeah, I was curious to hear a little bit more.
Yeah, no, I think that we definitely, yeah, tracks are a way that you can, you know, you're still getting the core rotations, right? So you're exposed to, you know, pediatrics and women's health and, you know, inpatient medicine, outpatient medicine, right, as being sort of core family medicine. But we also offer a lot of elective opportunity so that you can sort of pursue, you know, certain things that are not sort of strictly primary care based. And I think that also having tracks. So like I said, we have an underserved track. We have a sports medicine track. We have a women's health track where basically faculty members become, you know, sort of more concentrated on particular things. And so they will take those residents in and help train them, give them a little bit more experience, you know, with those things versus somebody who might not be as interested. So for example, the women's health track, you know, we'll send those residents, they go to the midwife center, they'll do some high risk OB. You know, we try to obtain for them more women's health or gynae procedures in the office versus maybe somebody who's more sports interested. And so, you know, they're doing more knee injections or something like that. So again, we try to kind of give you broad spectrum, but also focus your training a little bit if that's what you really want to focus on more so, you know, in your career. So that's sort of how we do it, you know, at the residency. Your practice too, it's really interesting, but you know, the more you are out in practice, the more people kind of get a feel for what you're passionate about and what you're good at and enjoy, and they will sort of naturally flock to you. You know, everyone's teasing me because you know, I have no problem admitting I have like all these 50-year-old menopausal women right now. Everybody's coming in telling me about their, you know, their hot flashes and they can't sleep and, you know, all these things. But I enjoy sort of doing women's health and talking to women about women's health, you know, and so by word of mouth or what have you, you end up sort of developing this practice, you know, that's sort of surrounded by what you're interested in to some degree. But in the residency, we definitely, you know, can help kind of lead you in one way or the other if you're interested in very specific things.
Thank you.
Sure.
I have two quick questions, if you don't mind.
Sure.
I know you said you're west of Pittsburgh. Is it kind of solidly suburban, or are you getting kind of closer to rural areas, or what's the community like?
Yeah, so it's actually east of Pittsburgh. So it's
Oh, I'm sorry, east. Yeah.
yeah. So it's really kind of the hub for AHN on the east side of Pittsburgh. So it's a large hospital, it's a trauma center. I think kind of the sickest patients, honestly, like on the east side of Pittsburgh, come to Forbes. It's the highest like level of acuity in that area. So it's probably about 20 minutes away from downtown. So I think that it's very high acuity. There's high volume there, so you're exposed to a lot of things, but it definitely has a community feel, at the hospital. People know your name, that kind of thing, which I appreciate. And I think the specialists, because of that, get to know the residents really well and vice versa. Because, like I said, we're really sort of working together all the time, in the hospital. So I think, it is a suburb of Pittsburgh, but it's very close to the city. And so, like I said, it's very busy, very busy place.
Great. And then just quick, was your path into family medicine pretty firm? Is that what you wanted to do, or did you think about other specialties?
I thought I was going to do OB forever. I did tons of electives in OB. I delivered all kind of babies, and loved it. And then one day I remember I was, doing a hysterectomy. I think it was like my third one for the day or something. And I was in the OR and I thought to myself, like, like this is not where it's at for me. So, it kind of clicked, like what I had to step back a little bit and reflect, like, what is it about OB that I liked so much? And I realized it was women's health. It was like the prenatal care and that relationship building and, talking to women about contraception and, having their newborn, and all of that kind of stuff. And I started to recognize like it wasn't the surgical part of the specialty that I loved. It was that relationship building part that I loved. And so my next rotation happened to be family medicine. And I was exposed to that exact thing when I was there. And I thought, okay, that sold, like this is the right thing, and then just kind of progressed from there. I think as family docs too, there aren't a lot of things that we dislike. I went on a lot of rotations and was like, oh, that's cool. I enjoyed that. And that was really interesting, and so again, the versatility, I think, is something, that we definitely sort of flock to as family docs. Radiology, it was too dark, like dark room. I couldn't do it. I am too like much of a people person to be a radiologist. But other than that, I think that, we tend to like a lot of things.
All right,
Is there
thank you.
anything else? Yeah.
So what kind of feedback do you get back from graduates that you think, oh, we need to work more on this, or we need to continue this in the
Yeah.
program?
Yeah, I mean, we do surveys all the time with the grads, and we're still close with them. They were just at the baseball game with us the other night. So we talk a lot, and two things. I think what I like to hear and what I'm proud to hear is that they can go on to do lots of things. So they do rural practice and they feel okay with that, and comfortable. They do, hospitalist medicine, they go on to fellowships. And I feel like all of those things show that it's sort of a well-rounded program, which is what I want to see. And I want them to have that experience. The one thing that I think that all residents kind of talk about after they graduate is the billing, like the more administrative aspects of medicine, that when you're in the thick of it and you're learning medicine, that's the last thing on your list. You don't want to learn about it. It's boring. I get it, but it becomes really important once you're out in practice, when people are talking to you about that side of medicine. And so a lot of them come back to me and say, oh, I wish we would have done more practice management. I wish we would have had more discussions on that and maybe paid a little more attention to that, while I was actually training at the program. So we've developed recently, based on that, a practice management curriculum where we try to, not in the first year because interns are just trying to figure out like what they're doing. But, as senior residents, we try to incorporate more of that into the program so that when you leave, you at least have some basic knowledge of kind of, stepping out into practice and being able to understand some of that stuff better. Good question.
Thank you.
Hello, Dr. Nicholas.
Yeah, hi.
My name is Madonna Parkham. I'm an international medical graduate. I have question about the interns when they start residency. How smooth is their transition? Do you offer them a 2-week boot camp, or how does that work?
Yeah, so we do something at our residency called continuing orientation. So everybody goes to orientation like the first week, before residency sort of officially starts. But we always joke, you retain probably about 5% of what we tell you during that week because you're waiting for your pager and you're looking for your schedules, and that's the focus. Where do I go on the first day, and how do I survive this? And so we do something called continued orientation, where every Monday afternoon, it's protected time. We bring all the interns back to our office, and we do topics with them. So we go over, how to triage an OB patient, or how to do a well child check, or certain things that are really sort of core bread and butter to family medicine, so that they feel like walking into these rotations, they have some idea of where to start, and I think that's something that they have told us that they find really valuable, and it's comfortable too for them to get back together as a group like that, to kind of just bond and get to know each other better. This year we also did something new, where for the first 6 weeks of the residency, we did intern only didactics. So again, things that seniors might be really comfortable with, interns walking in are not as comfortable. And so this year we tried something different, where we had, for the first 6 weeks, senior didactics and intern didactics, where we focused on topics, that were, again, more core family medicine, how to write a note in Epic, how to give a successful presentation, these kinds of things, where, again, it might be review some of it, but I think, again, starting off all on the same page, they really enjoy. And again, it's sort of a bonding experience. So those are a couple things that we've done this year to kind of get the ball rolling for the new interns.
Thank you so much. That's really helpful.
Sure.
And I really agree with your point about family medicine, that it's the versatility that draws us towards this specialty. Even during my medical school rotations, I think I saw practicing family medicine in every aspect of rotation that I did, including women's health. So thank you so much.
Absolutely. Well, I really appreciate, all of the good questions, and I appreciate y'all being here tonight. And, Scott, do you have my contact information? I mean, if anybody has any other questions, afterward or anything, feel free, to shoot me an email. I'd be happy to communicate with you after this too. If sometimes, when you get off the Zoom, you're like, oh, I thought of this, and, now I want to ask it. So I'm more than happy. Anytime, if you want to reach out, I'm happy to answer more questions if you'd like.
Yeah, great. I will put your email in the chat right now, if that's okay with you.
Perfect. Absolutely.
And then I just want to also say thank you very much to you for the great talk, and for all you're doing at Forbes. And thanks everybody for joining today.
Absolutely.